Everything that I've had done has been offered to me, or certainly the options available have been explained to me. But I didn't feel at any stage that I was having to sort of fight for anything. It was all there, and which is lovely, because in this day and age, there are such pressures on resources, and
well, there's no doubt that's ideal, but I'm just thinking now from the perspective of another person watching this who may not have been so fortunate regarding the steps flowing kind of naturally and having a result that they were really happy with. Sometimes the options either are not available or not appropriate for that stage or whatever.
Yes.
And those the result isn't really what the person was wanting, and sometimes people do have to fight for getting the treatment up to up to scratch, basically.
They do.
Do you feel you could have done that if you had to? Or I know it's difficult to put yourself in those shoes.
Yes, I do. I mean, in other areas I've had to, certainly with my orthopaedic problems, I've had to really make my point. So yes, I think I would know how to do it, but it was very refreshing to find that I didn't have to, and also to talk to people from other parts of the country who their experiences had not been as good, and it did make me really value what we have here. Because
I guess from a viewer's point of view, even if things haven't gone as smoothly as your situation, yours can be held up as an example of how things can go with good care.
Exactly, and mine wasn't without hiccups, because obviously in an ideal world the fixed implant would have worked. I mean, actually the main mastectomy and reconstruction op, I did bleed quite a lot. It took me quite a long time to recover, because it was at one point I was going to have a blood transfusion. In fact, my partner actually came to recovery. It was all a bit worrying, and so I ended up with probably having something like 4 general anaesthetics in a year. So it was all quite trauma. But even against that, I do feel that I've had good care. And it was, again, I think I was glad that I was told about seromas. I remember being given a leaflet thinking, I don't even know what that is, I'm not going to worry about it. But actually that came in useful when I needed the clinic. And although there were certain set days where I deal with certain problems, I found that I could ring the ward and speak to one of the breast care nurses whenever I wanted. So that was very useful as well. There was always that reassurance there. And that morning when there was a problem with the fixed implant and I did have this leakage, the fact I could ring the ward, speak to a doctor and be actually seen within a couple of hours was marvellous. There was no sort of, wait 2 days. So yeah, there is that level of care there. I know probably in some cases it doesn't always go to, and also you have to manage your own expectations. You do have to be aware that this isn't your natural breast. It's never going to look like it did before. But it's a pretty good job of it's considering you think what happened years ago with people having to rely on cotton wool, and really you cannot tell. And it's in my case I feel able to lead a normal active life. I don't really have issues, any self-esteem issues. And go swimming. I'm not worrying about if I'd had, I was lucky enough to be able to have it all done in one go, but I haven't got the worry of having a prosthetic breast and thinking, is it going to fall out of the swimming costume? Am I going to be chasing it? Everything's, and I'm really not bothered. I've got a slight scar on my back, and to me that's my battle scar. I'm actually quite proud of it. So yes, I think that my main advice would be to people, that I still think about this, if there are any changes at all do have them checked out. I was reluctant because I suppose I'd had the warning sign with the very, very minuscule amount of bleeding in the right nipple a couple of years before, which again was checked out and was okay. But the fact that there was, to me, and it was, as my GP didn't notice particularly, but to me, they didn't feel the same. And it didn't matter what I told myself. I tried to reassure myself and thought, well, yeah, perimenopausal, a lot of your friends going through the same thing. And I made one appointment with the GP and actually cancelled it because I got something better to do that week. And then I left it for another fortnight. So I probably left it a good, between noticing the change and going, probably 3 or 4 months. Now, because DCIS grows quite slowly, it didn't matter. But when I actually had my results back, I had got DCIS with microinvasion. I haven't had to have any other treatments, but my consultant said, we got it just in time. So I would definitely say, I know it's scary and the chances are it's only a cyst, but go and have it checked out. Certainly would. And also, talk about, I know it's a shock when you're first diagnosed, but ask about any reconstruction, about the different types, because I know they do them, well, most of them in Leicester anyway. So